pollution has multiple adverse effects on health. Their common effects are known, however, the rate of mortality and morbidity continue to rise. Several chronic disorders are triggered by many pollutants. Previous studies have provided abundant evidence on the association between air pollution and individual chronic diseases. Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I'm Mr. Zaman and today I'm going to discuss about effects of pollution on health and factors adding to increased death rate. Exposure to the air pollution known as fine particulate matter PM 2.5 is associated with an increased risk of having a cluster of multiple chronic diseases, according to a new study published this week in the open access journal PLOS Global Public Health. In the new study, the researchers used data on 19,098 respondents of the China Health and Retirement Longitudinal Study surveys from 2011 to 2015, as well as historical satellite data on PM 2.5 exposure over 15 years. Participants were people aged 45 to 85 from 125 cities across China. The team modeled the associations between self-reported chronic disease diagnosis and PM 2.5 exposure. The data revealed 4 distinct groups of multimorbidity, with patients sorting into respiratory, musculoskeletal, cardiometabolic, or healthy clusters. The analysis showed that a 1 microgram per cubic meter increase in cumulative exposure to PM 2.5 over 15 years was associated with a 2.4% increased chance of belonging to the respiratory cluster, a 1.5% increased chance of belonging to the musculoskeletal cluster, and a 3.3% increased chance of belonging to the cardiometabolic cluster. However, the models also showed a U-shaped association with both lower and higher PM 2.5 exposure associated with increased multimorbidity. The increased multimorbidity at the low end of the spectrum may be due to differences in rural-urban living and economic development, the authors hypothesized. The authors concluded that current PM 2.5 levels are harmful to human health among the majority of Chinese adults, and that for most low and middle income countries, efforts to reduce PM 2.5 would likely be associated with a substantial reduction in the burden of multiple diseases. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.